Thank you very much for your participation in the recovery trial and for helping us to recruit patients into it. This short video demonstrates how you will randomise people into the trial. Please bear in mind, randomisation does not have to be done by the person who obtained consent, but it must be done online and can only be accessed via the trial website, www.recoverytrial.net. From the homepage, follow links for randomisation. If you need to, you'll be able to download a participant information sheet and consent form from here. In case you need it, it is vital that you have consent before you start the randomisation process.
When you follow that link, you will come to the login screen for the randomisation website. Select your site, and this will auto-populate the site username field, and then type your site's password. If you do not know the password, contact your PI. After successfully logging in, you'll be taken to the home page, which consists of a table showing the latest 3 participants recruited at your site and a list of options available. These options are enroll patient into the study, view recent recruitment list, and log out. Firstly, let's look at how to enroll a patient into the study. This opens the patient enrolment form, where you'll need to answer each question before enrolling the patient into the trial. Firstly, question 1, enter the treating clinician's name. Question A2, the patient's surname followed by forename. A3, the NHS number. A4, the patient's sex. If the patient is female, you'll be asked a subsequent question asking if the woman is pregnant, followed by their date of birth for question A5. If the patient is less than 16 years of age, you'll be asked some additional questions. Firstly, if the child is less than 42 weeks of gestational age, you'll be asked, was the child born preterm, so less than 37 weeks of gestation, and enter the gestational age at delivery by selecting the weeks, then days. If the child is older than 42 weeks of gestational age, you'll only be asked, was the child born preterm? For all children, we ask, what is the child's weight? But for this example, we'll recruit an adult. For the patient to be enrolled into the trial, questions A6, has consent been taken in line with the protocol? And A7, does the patient have proven or suspected SARS-CoV-2 infection? The answer must be yes. And for A8, does the patient have any medical history that might, in the opinion of the intending clinician, put the patient at significant risk if they were to participate in the trial? The answer must be no. We then would like to know the COVID-19 symptom onset date, followed by the date of hospitalisation. Then answer yes or no to A11, does the patient require oxygen? And A12, does the patient currently require ventilation or ECMO? For question 13, we would like to know if the patient has any current comorbidities or other medical problems. For each comorbidity, answer yes, no, or not known if unsure. We then would like to know if any of the treatment arms would not be suitable for the patient. So, if the patient is receiving a drug which interacts with lopinavir-ritonavir and cannot be stopped, then answer yes. This will exclude lopinavir-ritonavir from the possible treatments the patient could be randomised to. We then want to confirm you have these treatments available at your hospital. If we know a treatment is not available, then you'll see this red message. In this example, we believe azithromycin is currently not available at your site. However, if you know the treatment is available, you can change the answer to yes, but please confirm with your PI. Finally, we want to know the name and professional email address of the person completing the randomisation form. Once all questions have been answered, press continue. You can see that a warning message has appeared indicating an invalid NHS number. You can correct the data by pressing amend. Once you are satisfied all the questions have been answered correctly, press randomise.
Thank you very much for your attention. I hope that all made sense. If you do run into problems, please check the study website. Or if it's not urgent, you can email the trial team. But if it is an urgent query, then there is a team of people on call through this number here. So please get in touch. But thank you very much indeed for your help and for your support for the recovery trial.